Hi, my name's Ben Murotto. I'm here to talk about advances in Parkinson's disease treatment. Parkinson's disease, or PD, is a complex neurodegenerative disease. It has a progression that slowly damages the brain's motor skills and cognitive function over time. The factors that invoke PD are largely unknown. However, its symptoms have been closely studied since its discovery. Parkinson's causes the degeneration of neurotransmitter cells in the brain, more specifically, the cells which produce dopamine. Like all neurotransmitters, dopamine is packaged into a synaptic vesicle, in this case, vesicular monoamine transporter 2, and stored until action potentials induce the release of dopamine into the synaptic cleft. This leads to binding of dopamine receptors in the postsynaptic neuron. Nerve fibers of the substantia nigra form a bundle which adjoins another part of the basal ganglia called the striatum and forming the nigrostriatal pathway. This is one of the major hormone pathways for dopamine, and it is the decay of dopamine-producing neurons in this area which incites Parkinson's disease. Dopamine receptors play a significant role in controlling factors such as motor skills and cognitive thinking. Changes in these areas are usually the first clinical signs of Parkinson's disease. It is not surprising that the debilitation of such a crucial dopamine pathway has such a profound effect on its sufferers. Symptoms affecting the motor system include the infamous Parkinson's resting tremors, reduced balance, and subsequently the loss of postural control. Another hallmark sign of Parkinson's is changes in the sufferer's walking patterns, or gait, and this can become problematic as the disease progresses. Major non-motor symptoms include, but are not limited to, things such as depression, various sleeping disorders, impulse control disorders, and disturbances of sensory reception. Recent years have bared witness to many advancements in the treatments of Parkinson's disease. In 2018, publication of new diagnostic criteria by the Movement Disorder Society indirectly helps PD sufferers to be diagnosed more quickly and accurately. The examination consists of a 4-part assessment and questionnaire that scores the patient's symptoms and gives them a rating on an MDS scale based on their responses. A clinical trial in 2018 assessed patients of Parkinson's disease with a drug called exenatide. Exenatide is a glucagon-like receptor 1 agonist and is usually supplied to the sufferers of type 2 diabetes. It primarily helps to control blood glucose levels in 2 ways, by stimulating insulin release from the pancreas and simultaneously inhibiting glucagon. Surprisingly, patients subjected to exenatide saw a far improved score on the motor skills portion of the MDS exam compared to placebo patients. Even more exciting is that these results were acquired in the off period of medication, 12 weeks after exenatide was ceased. This suggests that it may have a long-lasting beneficial effect for Parkinson's disease sufferers. Further laboratory testing of exenatide indicated that it has neuron protective properties and helps to induce the brain's ability to repair and create neural connections. However, its exact physiology is still unclear. Injuries from falls are the most common cause of hospital admission for people with Parkinson's disease. By alleviating the motor impairing symptoms of the disease, exenatide has the ability to reduce the risk of injury. Whilst more research is required to fully understand the relationship between neural connections and exenatide, this is a big step forward in alleviating and treating Parkinson's disease. Thank you very much for letting me share these new treatment advances with you, and have a great day.